Good morning. Thank you for joining us. We're just going to give it a few minutes as folks trickle into the virtual room, and we'll be starting shortly. Good morning. I'm seeing folks start to trickle in. We're going to give it another couple of minutes. We do want to start right on time, but bear with us for just another minute. It is 7:59. We'll be getting started in just another minute. Thanks for joining us. It's a great time. We'll actually give you just enough time if you need to top off that coffee before we get started. All right, folks are trickling in slowly this morning. I've heard that there's a bit of traffic out there, so we might be having a couple of folks joining us late this morning, at least on the in the virtual room. Right, it is 8 a.m. and I know we've got a lot packed into this hour, so we're going to get started. I also want to be respectful of folks' time, so let's kick this off. Welcome to Eggheads. Good morning. You're joining us for the Colorado Health Institute's monthly webinar series. Before I start, I want to let you know that this session is being recorded. And we've also activated captioning for speaker remarks, and you can activate that by toggling down to the button at the bottom of your screen, and you can turn that on for captioning. We're going to save time for questions at the end of today's presentation. But that said, if you have questions that pop up throughout the conversation this morning, please just drop them into the chat or to the Q&A, and our team members will respond as we are able. We might also ask you to hold on to your question if it's something we want to surface at the end, but we will certainly let you know. Finally, I'm Christy Ariano, Managing Director of Marketing and Communications at the Colorado Health Institute. Happy New Year. I think I can still say that, at least for a few more days. But I'm glad that so many of you are joining us this morning. I'm seeing some familiar names in the virtual room this morning, and I'm excited to see some folks that I had a chance to connect with last month at Hot Issues in Health. It was great seeing so many of you in person, and I'm glad you're continuing to join us virtually as well. That means most of you probably know a little bit about the Colorado Health Institute, but for those of you who don't, Colorado Health Institute believes that good health policy leads to a healthier Colorado. We're an independent, nonprofit health research and consulting organization. Our public benefit work is funded by generous philanthropic supporters, including the Colorado Trust, Caring for Colorado Foundation, and the Zoma Foundation. We're so grateful for their support. We also consult with organizations, including community groups, providers, state and local government agencies, and foundations to provide not just analysis and data, but complex strategic planning, facilitation, modeling, evaluation, and strategic communication. If your organization is interested in partnering with us, please reach out. And now I have the honor of introducing my colleague and your cruise director for this morning, Lindsay Whittington. Lindsay is a policy analyst and the lead data manager for the Colorado Health Access Survey. If you've watched the preview video that we sent out along with today's reminder, you might also know Lindsay as Jessica. Surprise, it's the same person. She is multi-talented. Lindsay?
Thanks, Christy. Good morning, everybody. And thanks for joining me and my teammates here bright and early to talk about some of my favorite topics. Again, I'm Lindsay Whittington, and I have been at CHI for a little over 3 years now, if you can believe it. And during that time, I have become the lead data manager for the Colorado Health Access Survey, or the CHAS, and helped expand and think through our data visualization expertise here at CHI as well. I'd also love to get to know some folks who are here with us today. So if you can, please drop in the chat your name and your organization that you represent. And also, if there's one thing that you're hoping to learn from today's webinar, feel free to also pop that into the chat as well. And again, as my colleague, as Christy mentioned, my colleague Jeff will be monitoring and tracking on questions that come through during the presentation. So please drop those in the chat or the Q&A feature as well throughout the presentation. And we will have time at the very end to go through those questions and comments as well. Let's see. Thanks everybody for participating. We got all sorts of folks from all sorts of different organizations. It's good to see some familiar faces on the call today. All right, so let's jump into what we're actually going to be talking about today, the fun stuff. All right, so to start, I'm going to discuss some key principles that we use here at CHI to guide our work around data equity and data equity principles. And after that, I will discuss what data disaggregation is, why it is important, and now how we have used these methods at CHI to really move the needle on data equity as it concerns data representation. We will then be discussing another great resource that we have developed this year, which is the Colorado Health Access Survey Data Dashboard. And finally, we will have time at the very end of the presentation to discuss any questions or comments that folks have top of mind after all the information that we discussed today. All right, so let's dive in. So we at CHI have been really thinking through what data equity looks like in Colorado and how we might make strides as a community to make sure that data supports and provides helpful information to community groups as well as community leaders in our state. First, data equity means that data is available to everyone. This can mean either that communities that the data are gathered from or groups that are trying to use this information to make meaningful change within those communities. Having access to real-time, frequently updated data is integral in making sure that policymakers and other stakeholders have the information that they can act upon when making important decisions. Secondly, users and collectors of these data all have responsibilities to make sure that these data are equitably collected, managed, and used responsibly. This responsibility is so important that I use the word twice in this sentence. One way that we think about this is by using frameworks that have already been developed to make sure that the approaches that we use are equitable. And one of these ways is really looking at human subjects research as kind of a framework to look at how these data can be collected, managed, and also reported on in equitable and ethical ways. And we have been using this framework, in the scientific community since about the 70s. So Jeff is actually going to pop in a resource in the chat that the Urban Institute has put together that really outlines how principles of human subjects research can also be applied to data equity principles. And I found this a really helpful resource when kind of thinking through how we can frame these things and using frameworks that have already been developed. So as we gather, maintain, and report on data that are coming from our communities, we must also make sure that we are treating these activities in a similar way, that our data practices are also equitable and ethical. So let's discuss this in a little bit more detail. So the three principles in human subjects research that we can also apply to data equity practices are beneficence, respect for persons, and also justice. Now, what does this all mean? So overall, we want to make sure that how we collect, maintain, and report on data benefits our communities, while at the same time reduces the risk of harm in those specific communities. Also, we have to make sure that these data are available to groups that can use this information to make decisions and act upon the data that we are gathering and maintaining. And lastly, our data efforts should spread the benefits among all people in an equitable way. So using these principles, CHI wanted to make strides in two activities that we believe move data equity processes forward in Colorado. These two activities were data accessibility and data representation. Data accessibility makes sure that we are able to provide public data that organizations and other stakeholders can use to address inequities in Colorado communities. And these data are both community informed and a community benefit. So for this specific activity, we created the CHAS data dashboard, which we will discuss later. Data representation allows for greater understanding of the communities that we serve in Colorado, if it be through the healthcare system that they try to navigate or through services that are provided to them from different community organizations in our state. So for this activity, we employed the method of data disaggregation. So to start, I'm going to discuss what data disaggregation is, why it is important to integrate into different types of work that we do here in our state, and how we are making strides in this method here specifically at CHI. So to start, what is data disaggregation? So data disaggregation speaks to methods that can help us uncover information about communities and people that are often hidden within data systems, nationally as well within our state. So through disaggregation, information is collected and analyzed at more granular levels that fall within larger groups. And these techniques are often used to understand more about racial and ethnic groups that are aggregated into larger categories in many different data systems. So an example of this that many might be familiar with is through the discussions that happened during the 2020 census and how the Census Bureau was thinking about adding the Middle Eastern or North African identity to the overall race and ethnicity data collection method. Although this change did not occur during the 2020 census update, people are still thinking through the importance of disaggregating the current racial and ethnic standards on the census to include this option. So Jeff is also now going to drop in a link to the chat of a recent article that discusses this example and how researchers are not done showing the importance of continually updating and refining racial and ethnic data collection efforts. So as you might have guessed from what we've already discussed, disaggregating data, especially racial and ethnic data, is incredibly important. These methods support that everyone counts and that everyone deserves to be seen, especially when it is information that could help us understand more about the unique diversity and stories that exist in our state as well as nationally. Data disaggregation also has really big implications for health. By disaggregating larger categories into more representative ones, CHI and others can understand health outcomes and behaviors that more accurately tell the full story of health and well-being for our communities. That way, we can more effectively provide interventions and other avenues to create positive change for these health outcomes and other experiences that might disproportionately impact groups that we just don't have that much information on currently. So now, with all of that in mind, I'm going to talk about some of our approaches that we took in our work to really dive into data disaggregation at CHI. So as many of you on the call might already know, either from my silly video or some other stuff that came out the last couple of years and the last 10 years, CHI is the data curator of the Colorado Health Access Survey, which is a survey that we field every 2 years. And our most recent iteration, which is the 2023 CHAS, we will actually be fielding this spring, and we're working on developing that right now. So this data source, it collects on all sorts of different information from healthcare access barrier issues, affordability concerns, behavioral health, social factors, as well as a wide range of demographic information. So as a part of our efforts in 2021, we also added disaggregated race and ethnicity data to the survey. So having the CHAS available to us was the perfect opportunity to pursue data disaggregation in Colorado. So since we have been working to expand the CHAS to be more inclusive of the most important issues facing Coloradans since 2009, we thought, why not use this resource related to data disaggregation on specific race and ethnic communities? And we wanted this process to be community driven. So during the 2021 survey creation, we engaged with a wide variety of different community organizations across Colorado to understand more about what communities exist within the larger racial and ethnic context in our state. So these groups were able to help us come up with specific groups that they believed was important to collect on, that would be meaningful and informative to them and other stakeholders in their work. So the next few slides outline the disaggregated racial and ethnic identities that we expanded upon to include on the 2021 and 2023 CHAS. So the text in blue on these slides is what we used to only collect on before 2021, and the black text is what disaggregated sub-identities were added. So first, we disaggregated the Black or African American identity to now include 5 additional sub-identities. And the Hispanic or Latino identity was expanded to include 8 new options. Within the Asian, within the Asian group, we now expanded it to include 18 different options. And under the Native Hawaiian or other Pacific Islander group, you now have 4 additional options that respondents can choose. Additionally, kind of taking the lead on the discussions from the 2020 census, we also added an overall Middle Eastern or North African option that individuals can now choose on the CHAS, as well as disaggregating that further into 24 additional options for respondents to choose on. So all of this taken together, we added lots of rich information, really thanks to the community groups and individuals that we engaged with during the 2021 survey collection and development efforts. So you might have noticed that we did not disaggregate the American Indian or Alaska Native group. So we intended to include a tribal affiliation or tribal identity question on the 2021 CHAS. But after we spoke to community groups, we decided not to include the question on the CHAS for a couple of reasons. We didn't have a clear plan for how we would use the data or ask community members themselves what would be helpful. And we did not build the relationships and trust within these communities and did not have a clear understanding of what we would ask. So for this whole process, we learned a variety of lessons, and we really want to continue this work as well. So here I wanted to highlight some of those lessons that we learned. First, really invest the time. It takes time to create meaningful relationships and build trust in communities. So many times researchers come into community and collect what they need and then leave. So continual engagement is the only way that you can really make sure that this research is possible and also helpful and meaningful for everyone involved. Also, share with communities how you plan to use the data. It's very important that they are involved in the different processes that involve their information that you are collecting on. Additionally, it's very important to seek a variety of perspectives. Don't just contact one person and then think that you did your due diligence in this work. As we know from our research, there are so many different unique identities, perspectives, and contexts that people live within, and it is important to make sure that you expand your thinking when doing this work. Also, understand the implications of what you are going to ask. There are very clear implications in Indigenous communities of asking about tribal identity, enrollment, or affiliation. Lastly, respect data sovereignty. Similar to land and resources, many tribes are considering how data are collected, stored, and reported to a component of their status as sovereign nations. So all of this taken together, all of this work that we've been doing for the last 2 years, I think it really highlights that CHI believes that the CHAS should be a community asset and can help inform on different decisions. It also means that the CHAS needs to be responsive to community needs, and information gathered should be meaningful to those whose data is actually being collected on. All of this cannot happen without meaningful engagement with communities every step of the way, during data collection, during how we manage and store the data, as well as how we report on these findings at the end of the day. All right, so now I want to share some preliminary findings from the disaggregated data collection efforts that we had and talk about some future directions that we are really interested in moving forward on. So to start, This disaggregated racial and ethnic data provide us with additional information about the specific communities within Colorado. So this first slide outlines the 8 sub-identities that we collected on within the Hispanic or Latino group. The percentages here represent the percentage of Hispanic or Latino individuals who chose each of the sub-identities, and individuals completing the survey could choose more than one. So these percentages won't add up to 100%. So based on the CHAZ, about 3 in 4 Hispanic or Latino Coloradans reported that they identified as Mexican or Mexican American. And you can see here that that represents over 750,000 people. Another 1 in 4 reported that they identified as Chicano. Community groups were really interested in seeing how different political or other identities were represented in Colorado. So that's why we added both Chicano as well as Latinx. So for the Latinx identity, it was really important to see, based on different information, how many people in Colorado are actually identifying as Latinx. So we actually saw here that 11% of Hispanic or Latino Coloradans identified as Latinx. So really thinking through some of these political as well as kind of like ancestral implications for this specific group was really interesting when talking with our community groups. So I did a similar analysis here for the sub-identities collected for Black or African American. So of the 5 identities added, a majority of Black or African American Coloradans reported that they identified as African American, which you can see here with 83%. We see also that another 7% of this population reported that they identified as Afro-Latino or Caribbean. Here is a similar analysis of the Asian sub-identities that we collected on. I think this one's interesting because we see here that there is no one majority, but a more even distribution across the collected identities. About 17% of Asian Coloradans reported that they identified as Chinese, while about 14% reported that they were Korean. So we can see that there is a very even spread of the different kinds of identities that exist within the Asian population in Colorado. You will also notice that this is not all of the different sub-identities within the Asian population that we collected on. There were just some that we just had too small of a sample size to report on for today's presentation. So now with those kind of distributions of the information that we collected on, I'm going to dive now into kind of why is this important and the kinds of information that we can look at using disaggregated data. So again, why is it important that we collect this information? So the next few slides showcase the kinds of things that we can learn from this granular information. So on this slide, this bar graph represents the percentage who reported that they experienced 8 or more poor mental health days in the last month by Hispanic or Latino sub-identity. So reported poor mental health rate differs between these sub-identities, as we can see from the bar chart. Those who identified as Latinx were much more likely to report experiencing poor mental health than the other groups, like Mexican American or Caribbean, which just had, Caribbean specifically had a much lower rate. So what might these differences tell us? This is where we can really start to understand intersections between different identities and implications on health outcomes for these identities. So those who identified as Latinx were more likely to be younger and also identify as LGBTQ+. So this has implications for how these individuals are more likely to talk about their mental health care, for example, or have distinct experiences that might lead to a higher mental health rate. So here is another example of how we can use disaggregated data. So this bar chart outlines the percentage who reported that they had a usual place to go when they were sick by Hispanic or Latino sub-identity. Again, we can see distinctions between the sub-identities, and this makes us think about what might be intersectional identities or contexts that might lead to these differences and how these individuals report on this specific metric. For example, those who identified as Chicano tend to be older and identify as male. This might mean that they are more likely to have some form of healthcare coverage or insurance compared to younger Coloradans, like those who identify as Latinx, who are less likely to be covered. Those could influence whether someone feels like they have a place to go to when they need healthcare services when they're not feeling well. So this might have implications for how easily people feel they can access healthcare services. We can see here as well that those who identify as Central American or Caribbean were much less likely to report that they felt they had a place to go when they were sick. These findings can help us with outreach efforts to specific populations to make sure that these individuals have a place to go when they need healthcare services. So these data are incredibly informative and also make outreach and other efforts more actionable. Without disaggregating these outcomes, we would have otherwise not known that some people are less likely to be able to get the kinds of care that they need, or know that some individuals are more likely to experience mental health care issues. So this is my last slide of the data findings on this section of the presentation, but I think this is one of the more telling. So I have spent a lot of time at CHI thinking through what healthcare access means for those whose first language might not be English. What might be distinct barriers to care that these Coloradans face? And what are ways that we can be responsive to their healthcare and language needs when accessing services? So this bar chart shows the percentage who reported that they speak a language other than English at home by race and ethnicity. You'll notice that the race and ethnicity groups here are the aggregated ones, and this is on purpose, and can really help us understand the importance of why we want to disaggregate data in this context. So here, we see that 2 in 3 Asian Coloradans reported that they spoke a language other than English at home. But remember back to our sub-identity data, there are entirely unique language and cultural groups that live in Colorado who fall within this aggregated group. Languages and cultures like Chinese, Vietnamese, and Korean, among many others, fall within this group, all having different needs. And how can we be responsive to those needs? I think this is a really good example of why disaggregated data is so important. Without it, we aren't sure what exactly makes up this 66%, what distinct language needs that might be required when they're accessing care, or the other kinds of outcomes that might be distinctly impacted one versus another within these larger groups. So that wraps up the data portion of the presentation. Now I wanted to shift gears a little bit to introduce a project that CHI has been working on with partners at the UCLA Center for Health Policy and Research. For the past 2 years, we've been investigating and outlining methods that can be used to disaggregate data, not just within one data system like the CHAS, but within multiple data systems in Colorado. So some data sources, as you all know, collect more granular information on race and ethnicity, while others collect a more aggregated set of identities. So what kind of information might we be able to get if we're able to disaggregate data within these larger data systems? And that's what we really set out to find out. So the 2 data systems in particular that we're interested in, that we want to engage with and understand if we can further disaggregate information within their own data systems, are the Colorado Health Observation Regional Data Service, or the CORDS, and the Colorado All-Payer Claims Database, which is out of Civic. So both of these data sources have a plethora of information on diagnoses, screenings, and utilization patterns of services on millions of Coloradans. Because of this rich information, we developed a list of guiding questions that we use to guide this work. One of the overarching questions that really came out of this was, what is additional research questions that we can ask once data are disaggregated within these data systems? So if we disaggregate data in these large data systems, it now allows us to dive deeper in to understand more about healthcare utilization. Because of this, one of our more focused questions that we are able to now ask are certain groups more likely to receive behavioral health screenings or services compared to others? So we are currently undertaking this work. So we're really excited to dive into this project this year. It's going to be moving between now. We just kicked this project off and we're going to wrap it up in the summertime. So I'm really excited to see the results of this research project so that we can come back and kind of talk through the important findings from this disaggregated, this data disaggregation project and how it fits into lots of the other work that we're doing here at CHI. So I just wanted to highlight a couple other exciting future directions in this work. So first, because we will have 2 years of collected data on our disaggregated race and ethnicity information after the 2023 CHAS gets fielded, we will be able to combine years of data to understand more about the identities that we were unable to research currently due to issues with sample size because of only 1 year of data. There are also some possible implications from legislation. So folks have been really thinking through data collection efforts in public health surveillance, specifically on how we collect and manage demographic information within those systems. So helping make sure that these systems talk to each other and have standards that collect this information more uniformly will be a really exciting add to the way that we're able to investigate important outcomes within our communities. So that's really exciting to see kind of the what comes out of legislation this year and the next couple of years. As well as it's really important that we keep engaging with our communities. This is one of our main features that we're really trying to dive into, to really making sure CHAZ is a community asset. So we just want to make sure that the data we collect on is useful and meaningful to communities and that it's actionable as well. So just really thinking through our engagement strategies as we move forward for the next couple of years. All right, so that wraps up the section on data disaggregation. And I want to acknowledge that this was a lot of information, and I'm sure folks probably have lots of questions or comments. So please just continue to drop those in the chat or hold on to them until the end of the presentation. I promise we'll get to them in a few. But right now, in addition to data representation, we at CHI wanted to make sure that people have access to those kinds of meaningful information on their communities and regions of the state. So to help provide CHAZ data to everyone, we created the CHAZ data dashboard. All right, so now I'm going to move to where it actually lives on our website. All right, I'm going to look for, does everyone see the Colorado Health Access Survey webpage? Can I get a thumbs up from someone on my team? I don't see anything, so it's probably fine. All right, there, I got a couple. Thanks, Christy. Okay, so I'm really excited to share this with everyone. I've been working on this for, I think, about 6 months now, and it's finally live. So where you can actually find the new CHAZ data dashboard is under our work on our website under the Colorado Health Access Survey link. So it'll take you to the main landing page, and all you have to do is scroll down, and it'll provide the actual dashboard on our website. And you can either view it on the landing page here, or what I like to do is click on the view dashboard for a full wide screen on the bottom so that it opens it up into a web page all on its own. So here, when you open it up, it really spreads, it has 2 distinct information types that you can add on. And basically we have this information either by demographics or by the map. So I just now realized I jumped ahead, and here we go. The purpose of this data dashboard was to provide public data to community groups, decision makers, and other organizations who need this data to answer questions about their communities. And as you might have already seen, there's a demographics page available and a regional page available. So the data that is available on the demographic analysis page, the topics that we have are mental health, oral health, social factors, insurance coverage, barriers to care, and healthcare affordability. And you can take these topics and actually analyze them by specific demographics. So the demographics that you can look at all of these topics by are sex, race or ethnicity, age, insurance coverage type, general health status, and income. And on the regional tab, which has a map, the topics that we have available right now are mental health, oral health, social factors, and insurance coverage. And the available analyses, you can look at any one of the indicators that are available here over all of the different years that it's been collected on the CHAZ. So if it's been since 2009, you can actually visualize these over time, which is really helpful. And you can actually look at the data either by the estimated percentage or the estimated count of the number of people that that indicator represents. So I think that's a fun function to see, what does 15% of this metric actually represent when it means people? We want to make sure that this is people forward in the kinds of data that we have available. All right, so now is when I was supposed to pull it up. So here we go, back to here. Okay, so here's the actual dashboard. I opened it up into a large view so that I can look at things more easily. So for the demographic page, I'm just going to give a couple examples of how to use this. So you can start here on the left-hand side with your selection metrics, which you can click on the little button, and it'll drop down all the distinct metrics that we have available. So for this one, I'm really interested in social factors. So I click on the social factors topic, and it opens it up for the kind kind of set demographic category, which will be sex. So when you open it up, this will give at the very top ribbon, it'll tell you which demographic characteristic you're looking at. So for me, I'm really interested in how these metrics look for race and ethnicity. So I can click on the demographic category of interest and then further explore the differences between the set race and ethnicity information we have available. So I'm interested to see how these metrics fare for the Hispanic or Latino population in Colorado. So I can autofill, it autofills everything and is very responsive. So a couple things I wanted to highlight on this page is in each ribbon, based on the metric that you're looking at, there will be a little information icon that you can hover over. And this information icon will tell you the question that this information represents on the CHAZ questionnaire, as well as who is included in that analysis. For this one specifically, for the childcare question, it is asked of those who have children age 17 or younger within the household. So that's kind of how you can grab some quick information for the denominators of a certain question, as well as the information on how it's asked specifically to respondents. So additionally, you can grab lots of numbers from these pages. So based on the demographic characteristic I'm looking at, I can actually grab the specific metric for Hispanic or Latino, as well as getting a state comparison for that metric. So I can see, what are the differences that exist between the overall population in Colorado and those who identify as Hispanic or Latino. So you can get lots of rich information from each of these pages, as well as comparison groups that are interesting to you and your work. So additionally, in addition to the demographics page, you can also look at things regionally as well within the state. So very similar to the demographics dropdown, you can select a topic of interest, and this is organized by overall topic. So I can scroll down and see, oh, yep, we got oral health, we got mental health, social factors, and insurance coverage. So for my work, I'm really interested in housing instability. So I can click on the housing instability metric. And I really want to see how this is actually asked. So I come up here and get the information on the survey questionnaire. And this one's really interesting because we can look at this one over time. So I can pull the scroll bar over to actually see how this metric changed from when we asked it in 2019 to 2021. So I can see here, I can grab the 2019 numbers for each of the distinct health statistic regions in Colorado. And each one of these is labeled with the counties that are included within that, so that it's a little bit more meaningful for folks who are specific counties. So I can see here, okay, Larimer County got 5.6%. Let's see how that changed in 2021. So I can move that metric forward. We can see that Larimer County didn't change a whole lot. That's health statistic regions too. So this is a helpful way that individuals who are serving very specific geographic communities in Colorado can get data that they can use in either CHNAs or other additional resources or reports that they're working on in their area. So that's the regional map. Oh yeah, and just wanted to highlight, you can either do percentages or number of people. One thing that I really wanted to highlight too, as we're talking about data disaggregation and data equity, we wanted to really highlight that this information is not just a number. We don't love just providing naked numbers at CHI. So what we've done is put together information about health disparities in health data, and how that a lot of these are coming up because of issues around, discrimination, racial discrimination. There's lots of things that lead to differences and disparities across our different communities in Colorado, as well as nationally. So we wanted to highlight that these numbers are not just a value, that these represent people, and really thinking through, when you grab these numbers, what are implications of why those differences might exist. So always wanting to include some of the why in the information that we provide at CHI. So that's the CHAZ data dashboard. Let me pull back my notes. Okay, that is all I know I jumped a lot of information on everybody, but that is all the information that I have for you all. And I'm really excited to now have a discussion or talk through some of the Q&A stuff that we've had in the chat. I see Jeff's back. So just wanting to open it up for everybody and to see the kinds of questions that folks have on the information provided today.
Yeah, thanks, Lindsay. Can you hear me okay?
Yes.
Okay, well, we do have a question that Dale White submitted to us. And Dale, if you can raise your hand, then that will allow us to unmute you, and then you can ask your question directly to Lindsay. It's about the availability of geographic data.
Okay.
So, Dale, let's see. Okay, there you go.
Thanks. Hopefully you can hear me now.
Yes, go ahead, Dale.
Good morning.
Thanks, Jeff. Good morning. Thank you, Lindsay. The question that I chatted in, well, first I want to say that the information that you all put together is like our go-to source. I don't know how we could be informed to do our work without it. So thank you so much. And my question is about the detailed data by county, specifically related to health coverage, because that's my area, and whether that's available from the website or whether we need to request that level of detail through your email.
Yes, great question. Thank you for that one. So the way that the CHAS is sampled, data is only available at the health statistics region for the different metrics available. That's the most granular geographically that we can do. We have done some small area estimation in the past. So like there is options for doing that, but as the data stand right now, it is only available at those larger regions. Now, that being said, a lot of counties in Colorado are their own health statistics regions. So that does line up a lot of the time, but unfortunately for rural areas, those will be more aggregated regional areas. So you're able to get a lot of that information from the CHAS data dashboard, but for anything that you don't see that you are interested in looking at, all you have to do is my contact information is on the CHAS data dashboard, and you can easily reach out to me and I can put together more specific data requests for people. If they're like, I'm really interested in this specific metric that I don't see available, I can do a little bit more math and do combinations of years to get you more specific regional estimates for your information so that we can make that more reportable, which is nice. Yeah.
Just want to add, in addition to the dashboard, we do have on the CHAS website HSR level fact sheets, as well as regional spreadsheets. So if you don't find, this is kind of a brand new dashboard, it doesn't have everything. So if you don't find it in the dashboard, you might also look at the fact sheets or the downloadable spreadsheets. But I will add, just ask us too. You know?
Yeah. And so for folks on the dashboard page, you can easily find each one of those things that Christy mentioned by scrolling down to the specific year of interest. So for the most recent year, you can scroll down and get 2021. And then if you scroll down further, you can see the download data page, as well as download survey materials if you're interested in how the questionnaire is worded. And those fact sheets that Christy mentioned are just this drop-down menu. So you can grab the specific regional fact sheets that we put together last year. That was a great flag, Christy.
Lindsay, I also wanted to acknowledge and do some shout outs to some folks that we have here joining us on this webinar today. There was a question that was submitted through the Q&A about how we can find more information about some of the data sources that you mentioned. So the two being the Colorado Health Observation Regional Data Service, or CORDS, and I will put the link to more CORDS information in the chat. The other one being the Colorado All-Payer Claims Database, which is really stewarded by the Center for Improving Value in Healthcare, or CIVIC. And Pete Sheehan is on the webinar today. So thanks, Pete, for joining us. He had shared his contact information, and I'm going to just put that into the chat as well. So anybody who wants more information about the Colorado All-Payer Claims Database, Pete is a great resource. I believe our colleague Paul Preskin is also on the webinar today, and Paul is a great resource about the CORDS database. So I'm going to put that in the chat as well. Are there other questions? Feel free to put them in the chat or raise your hand or in the Q&A function of Zoom.
Rachel, you're unmuted. Go ahead and talk.
If you're unmuted, we can't hear you right now.
Well, this is exciting. It sounds like part of the silence is that people are too busy playing with the dashboard to ask questions.
Yes, that's
So
what it is.
that makes me very happy.
I'm happy to jump in. Can you hear my voice?
Yes, we
Yes.
can.
Hi, this is Elise Wall. Calling in from Boulder County Public Health. Thank you so much for sharing this data. Very excited to dive in. And thank you, the previous person who asked the question. I had that same question of how we could get maybe some
Mhm.
regional or county data. I guess another question I have for you, Lindsay, is around, so it sounds like if respondent, well, how do I want to say this? It sounds like if there are certain populations within the disaggregated data that are so low, that data is still suppressed. There's no weighting going on in order to make that data available. Is that correct?
Yes, that's correct. Yeah, we were thinking through additional methods on how we could make like the data that we do have available for a singular year more usable. We did investigate some weighting options. We didn't end up doing that, but that's a great flag as well. That is an option that other institutions and other places have used to really understand more about these small numbers. But no, we have not done that yet. But thankfully, I was really excited to see we've really been focusing on our sampling method to make sure that we oversample in a lot of these populations that we're most interested in knowing about. So that was really successful in the 2021 survey. So with the 2023 survey, additionally, I think with that sampling method, as successful as it was last time, to get some of our populations that are often underrepresented in some of these survey methods, I'm really excited to get the data to see what we can do with a 2-year combined, because I think we'll be able to say a lot about specifically the 3 that I reported on. I think we'll be able to say a lot more interesting findings for really like the Asian population is one of the larger ones that we'll have more numbers on. So I'm excited about looking into those kind of the results page instead of just like the distribution stuff that we looked at so far.
That's cool, Lindsay. And do you have anything on the dashboard itself that kind of speaks to that for external folks? And part of the reason, I guess, to be transparent, part of the reason I'm asking all this is that BCPH is exploring kind of revamping our data dashboard. And I know that one of the issues we are going to run into is that folks are really interested in doing those deep dives on specific populations. For example, LGBTQI trans youth, right? And unfortunately, the sample size for that is so low that, you know, it doesn't feel ethical to release that data and make that publicly available. And so just exploring kind of what other data dashboards are doing around making that data as available as possible without, you know, doing anything unethical and sharing that information about certain populations within our county. So it sounds like you do have that on your site, speaking to like, you know, data that can't be available or, you know, and why it's not available.
Yeah, like really trying to show like this isn't everything, but this is what we feel we can ethically report in a dashboard where you can kind of cut it in a couple of different ways. So yeah, the demographic characteristics that we included are ones that we know for a fact are reportable at any of the levels that you're looking at. And additionally, I feel like one method that could be kind of like to showcase a little bit of like populations of interest could be almost like profiles of like almost like snapshot profiles. That's kind of like what we try to do is kind of paint a story and not just give you everything on mental health on a page, but try to be like, here's what we saw as most important 4 metrics here and trying to paint a picture there. So I feel like for populations of interest, I wonder if there's like, maybe not fact sheets, but something that's a little bit more interactive to that you can kind of like put together as like, this is a population we know is important. We can't do a whole dashboard like drop down menu on it, but here's like a profile that we did on one of the pages of the Tableau dashboard or something. I've been struggling with that too, of like trying to figure out like, we know this is important, but where does it live? What's the best way to present it? What's the best way to visualize it? But those are all really good questions on like, what do we do with these small numbers? And because we want to make sure that people are seen and represented in these kind of visualizations.
Awesome. Thank you, Lindsay.
Lindsay, I did type in an answer to this question, but would you be so kind as to toggle back to the 2021 Chaz page and show folks where you found that data? I think we were moving a little fast.
Wait,
I'm sorry, on the website, on the dashboard. Yes, that page. Show folks how we got here.
Gotcha. All right. So you land on the main webpage for Colorado Health Institute. I almost said Colorado Health Access Survey. You go under our work, which is the very first ribbon, and then you scroll down to the Colorado Health Access Survey page. So you click on that, and then that's where the dashboard will live on the main page. If you just scroll down here, again, you can click it to get a full view, which I think is easier to mess with sometimes. And then if you scroll down additionally, you can get all of the different research materials and reports that we put together for each year of the CHAS.
Can
So
you click through on 2021 and show folks those extra materials?
Yeah, so then you scroll down, click on the 2021 ribbon, and here's where you can get our report that we put together on the 2021 data, as well as the additional data workbooks that we put together. So here under download data, you can get data regionally that we put together, as well as specific topic areas. So this will be data around barriers to care, COVID-19, health insurance, and those will include the data over time. So based on what you're looking at, you're going to get it over time, as well as for demographics. So you can look at any of these and try to get information based on what, if you're looking at it regionally or demographics. Additionally, download survey materials. You can get the survey questionnaire. There's also, we have a public use file available, as well as the application if people want to get a raw data file for the research file. So you can apply for that as well if people would like to have access to the CHAS data. And then the regional fact sheets that Christy mentioned are available in this drop-down menu as well. And then just additional information that we have from our overall report on this page as well.
Lindsay, can I get you to scroll all the way down to the very bottom of this page?
Yes.
I would just be remiss if I didn't add, we mentioned UCLA and their support of the data disaggregation work, but all of this data, the fact that it even exists is because of our sponsors, the Colorado Health Foundation, Community First, we mentioned UCLA, Department of Healthcare Policy Financing, Colorado Springs Health Foundation, Delta Dental. We had question sponsorship from the Latino Community Foundation, also sponsorship from Office of Behavioral Health and the Rocky Mountain Health Foundation. And I just cannot extend enough of my gratitude. So please thank our sponsors when you encounter them in the community and let them know how much you value this information.
Oh, here, let me just, I toggle back. I also wanted to shout out that for the February Eggheads, we're going to be talking about our climate and health policy agenda. So that'll be on February 23rd at 8 a.m. as well. And we'll send out some links on how to register for that in the upcoming days. That'll be our next presentation. And then if anyone has any questions on the data or other kind of CHAS related questions from the presentation today, feel free to reach out to me. And my email is provided here, and I'll also drop it in the chat.
Can I call out a question we've got from April? Yes. She is wondering about our plans for updating the dashboard.
Mm-hmm. Well, I am hoping that we do it every year and all the time. So the plan is that we continually update this resource each time that we have new information. And we worked with really great partners who, this is all built in R Shiny, just for people who are data visualization folks on the call. So we are able to, the way that it's hosted right now, we can easily update it with new information. So it shouldn't be very hard, shouldn't be very difficult to update. So when we get the 2023 information, we'll be able to plug that in there and update that dashboard when those are available.
Since I'm doing a little bit of a shout out to our CHAS sponsors, I will just also really give that plug for the 2023 CHAS. That survey is going to be going into the field, we expect, in March. So goes to 10,000 plus Coloradans. If you are among the lucky folks that gets that envelope in the mail, please fill it out, because I think I'm probably preaching to the choir here, but you know the value of this information, and we can't get it done if people don't take the 20 minutes that it takes to answer these questions either online or by phone. Sarah says it's a badge of honor to participate in the Chaz. I always secretly hope that I get it in the mail. I haven't yet. Oh, David's asking a question about, are we running into troubles getting people to respond to the Chaz?
Oh, that's a good question. Jeff, do you want to? I say come off you.
Yeah, this is Jeff Bontrager, and I head up our Chaz efforts at CHI. And David, thanks for the question or comment about surveys being problematic. And certainly we do everything that we can to ensure that we do have a representative sample. The overall trend, of course, has been that survey participation is changing over time. We saw, in particular, a decrease in terms of survey response when the Chaz used to be just a telephone-only survey. And because of that, we now administer the survey in a different fashion, which is that we mail people invitations to complete the survey. And then people can either go online or they can call in an 800 number to complete the survey. We do a pretty sophisticated approach with stratifying the survey sample to ensure that we have geographic representation as well as representation among specific hard to reach populations, such as low income populations, people who identify as Hispanic or Latino or Black or African American, households with children, et cetera. So we feel relatively confident about the representation of the survey, but it's always an evolving field and something that we pay very specific attention to ensure that we do have quality data.
And thank you so much to everybody who joined us today. We will follow up with an email that includes not only a link to this video, but also some of the resources Jeff and Lindsay shared, as well as an invitation to join us next month. Thank you and have a great day.